Good afternoon, everyone. Super excited for this presentation and conversation today. It comes, of course, at a timely time. I think we're based in Denver, Colorado Health Institute, based in Denver, and I think we're gonna hit 100 degrees this week. It's already starting to get hot, so super timely subject as we move into the summer solstice here this week. Um, Hi, everyone. My name is Karma Mahmood. I'm the Managing Director for Partnerships and Development with the Colorado Health Institute. We are super excited for this conversation today, really exploring the connection between extreme heat and mental health. Thank you all for joining. My organization, CHI, in partnership with the Colorado Department of Public Health and Environment and our friends at the National Network of Public Health Institutes, are going to be sharing some findings from a heat and mental health sort of research and literature review that was conducted as part of what's called the Public Health Infrastructure Grant Technical Assistance Program. So you're going to hear from a variety of really awesome hosts. And before we move to the next slide with who those hosts are, a little housekeeping. Feel free to, as you have questions, and as questions come up, feel free to use the Q&A feature just at the bottom of your screen to submit questions. And as folks are trickling into the presentation, I'd love for folks using the chat feature to put their name in the chat and put where you are calling in from, your state, your jurisdiction, the land that you're coming from. Love to know where folks are coming in from. And then, yeah, feel free to use the Q&A feature. We will have a Q&A session at the end where all of our panelists will be available to answer questions. And we'd love to keep the chat for audience engagement. So your hosts today, we have a really great set of hosts. First, we got Braden Nicholson, who's the Climate Resilience Communities Manager at CDPHE, the Colorado Department of Public Health and Environment here in Colorado. Jaime Jimenez, he's a program manager for environmental and emergency preparedness at the National Network of Public Health Institutes, joined by his colleague, Director for Environmental, Diana Hammer, the Director for Environmental and Emergency Preparedness at NNPHI, myself, and then my colleague, Maggie Hart, who's Climate and Health Research and Policy Analyst at CHI, who will be sharing some of that research here shortly. Just really quick, Colorado Health Institute, my organization, we are a nonprofit public health institute. We're based in Denver. We do work in Colorado, the Rocky Mountain region, and sometimes as well, national partnership. We work to improve the systems that influence people's health and well-being. The environment and our built environment are things that can impact our health and mental health. And we provide resources for folks that are trying to make sense of those confusing systems to make them more effective and make them more equitable. We do that by answering critical questions, making sense of complex issues like the intersection of extreme heat and mental health, and supporting others to reach actionable solutions. So, the intersection of climate and environment and mental health and extreme heat and mental health is a critical topic. Of course, as I said, it comes in a week where we're starting to see some record temperatures across the country. It's going to breach 100 degrees likely here on Friday in Denver. And it's just becoming a more increasingly apparent issue in public health as temperatures are rising and communities are grappling with the health effects that extreme heat can bring. There's a series of different articles up on the screen you can see from local and national sources. But it can feel very helpless against this kind of backdrop of extreme heat and how it can impact communities, which is why it's important for us to come together to talk through and learn from one another on what we can do moving forward. So our agenda for today is really centered on, we're first going to hear a little bit about how the CDC FIGS, or the Public Health Infrastructure Grant, TA, can be used and how it has been used to support this work. We're going to reflect on that intersection I described of extreme heat and the effects on mental health. And we're going to learn a little bit about what Public Health Department, what our friends at CDPHE are doing to reduce the impact of extreme heat on mental health in Colorado. And then at the very end, we're going to have ample time for hearing questions from the audience and just having a good dialogue at the end of this conversation. So with that, we're gonna really talk through now sort of how this work was done through the public health infrastructure, also known as FIG technical assistance.
Yes, this work could not be done without the Public Health Infrastructure Grant Program, which is a groundbreaking multi-billion-dollar investment from the Centers for Disease Control and Prevention to really help health departments across the US strengthen their workforce and infrastructure. So FIG focuses on workforce, foundational capabilities, and data modernization as their three strategies. And these come together to create long-term impact, and they also lead to accelerated prevention, preparedness, and response to emerging health threats, and to improve outcomes for other public health threats. 3 national agencies were also funded and tasked with leading and coordinating this technical assistance for the health departments. NMPHI, or the National Network of Public Health Institutes, is one of these national partners, alongside the Association of State and Territorial Health Officials, ASTO, and the Public Health Accreditation Board, or FAB. As of January 2024, a total of $4.01 billion was awarded to 107 public health departments in all 50 states, Washington, D.C., 8 territories and freely associated states, and 48 large localities. And this was through CDC's National Center for State, Tribal, Local, and Territorial Public Health Infrastructure and Workforce. Today's webinar is supported by funds made available through CDC, and this investment ensures public health agencies are able to protect communities, respond to these emerging threats that we continue to see, and build a stronger, more resilient future.
Thank you for that introduction to FIG and the national partners, Jaime. So NMPHI is using a regional innovation hub model to provide training and technical assistance to our FIG recipients. So a FIG regional innovation hub consists of one or more non-governmental public health organization that work with either the state, local, territorial, or tribal health department to analyze and operationalize essential public health functions in the region. A public health institute, such as Trailhead Institute in Region 8, serves as the coordinating hub for the region, and it may be supported by additional public health organizations. And these additional organizations serve as partners or as spokes to the hub. So this hub and spoke model allows NMPHI to coordinate and deliver tailored training and technical assistance. So upon receiving the technical request from the Colorado Department of Public Health and Environment, we worked with the Region 8 Hub, Trailhead Institute, to conduct the literature scan to explore the relationship between rising temperatures and mental health. And furthermore, we partner with the Colorado Public Health Institute, a Region 8 spoke, to grab those resources that were developed and organize and facilitate this comprehensive webinar on heat and mental health.
Thanks so much to Jaime and Diana for sharing an overview of the Public Health Infrastructure Grant, or FIG. Now we will dive into how CDPHE used FIG technical assistance. So through conversations led by CDPHE, local and state partners highlighted their increasing concern about the connection between mental health and climate-related stressors like heat, and they raised it as a topic of interest for Colorado to be able to address climate mitigation, preparedness, and recovery. And the overall goal for this effort is to inform future public health programming, education, and advocacy to help mitigate the mental health effects of heat exposure in communities across our state. And due to CDPHE's small staff and limited capacity, we first partnered with a Doctor of Public Health, or DRPH, student from the Colorado School of Public Health to complete a capstone project specifically around conducting a literature review exploring immediate and long-term mental health impacts caused by heat, which included anxiety, depression, PTSD, suicide, aggression, and gender-based violence. CDPHE also submitted a technical assistance request through the CDC FIG grant process to be able to leverage additional support, which was then directed to NNPHI in the Trailhead Institute and then supported by Colorado Health Institute. Next slide. So from the grantee perspective, CDPHE, we went through the CDC FIG technical assistance request process, and we really want to highlight a few things from this. So first, it was a very seamless and straightforward process, which was really great for us. We were able to meet with FIG staff, share more about our requests directly, and then collaboratively identify the appropriate next steps to be able to move forward in a way that was both meaningful as well as effective. And in fact, NNPHI and Trailhead Institute listened to our needs so well that when they sent the initial draft to us, we had no feedback. And it was exactly what we needed and what we were looking for. They truly went above and beyond and exceeded our expectations. And overall, it increased our capacity to be able to support local public health agencies and other local and state partners. It also helped us identify evidence-based public health solutions and strategies for local and state governments. Without their support, we would not have completed such a thorough review of the literature under such a short timeline. And again, I want to reiterate that our staff is so grateful for the technical assistance support that they provided, and it was able to provide us an opportunity to strengthen our skills, develop additional resources and capabilities. And NNPHI, the Trailhead Institute, as well as support from Colorado Health Institute, helped us continue to identify and inform public health programming and strategies for our state. Next slide.
Great. So I see there are some folks already joining our mentee. We'd like to see if you have experience working on climate-related issues. So do you work in climate or the climate and health space? Maybe you're new to the space, beginning to work in climate or climate and health. But it's great to see we have a lot of either just starting or do have experience. And if there are those who aren't familiar, we'll get to a question in a minute to hear about what you'd like to learn. So again, it's going to be menti.com with that same code. And so you should be able to type in what types of issues you work on. Shade policy and implementation, heat-related, waste-related, and water-related issues. A lot of heat, that's great. Extreme heat and poor air quality. Hurricanes' impact on food access, great. Heat and air quality. Burn up compost, very cool. Extreme heat, air quality, and wildfire smoke. Here in Colorado, we're very familiar with that. Heat knowledge and prevention with tribal elders, that's great. Definitely a lot of heat on here and extreme cold, as well as the air pollution and environmental impacts, but a lot of different things going on as well. So it's really exciting to see what everybody is working on. Some overlap, but also a lot of new things, especially for us in Colorado. We don't really work on hurricane impact, so it's very exciting to have some folks working on that here. Yeah, great. Protection for outdoor and indoor workers, impact on chronic diseases. That's great. I always am so interested to see what people are focused on. And then what are you excited to learn today? So even if you work in climate and health or climate or don't, what are you hoping to take away from this webinar? Or what brought you here? Distress. New innovations, impact on mental health. Strategies and practices, working on partners. Policy ideas, community. Great. These will definitely be things we'll be touching on. We'll hear about some strategies that CDPHE is using, and then later we'll also hear what's happening at NNPHI. But I'll give it another second for more folks to continue to put some responses in so we can see what everyone is here for today. Continuing on the strategies, impact on mental health, new innovations. Great. Awesome. Well, thank you all so much for sharing all of that. Josh, we can head back over to the slide deck. It's really great to see what people are working on in the climate field, or for those who are interested in what you want to hear more about today.
Yes, it's exciting to see that split between folks who are experienced in this setting and work and those who are new. So a little bit of climate context to get us started. So across the nation, we are seeing more extreme weather events. That's a fact. In 2024, NOAA's Center for Environmental Information confirmed $27 billion weather and climate disasters just in the US. And these events range from severe storms, tropical cyclones, wildfires, drought, flooding, and winter storms. And according to NOAA's 2024 Climate at a Glance report, we are seeing average temperatures increase across the country since 1901. In fact, 9 of the top 10 warmest years on record have occurred since just 1998. And I'm not going to give my age or anything, but quite a lot in my life. Average global temperatures show a similar trend, and 2014 to 2023 was the warmest decade on record worldwide. Within the US, temperatures in parts of the North, West, and Alaska have increased the most. And with that in mind, it's important for us to acknowledge there are several groups who are at greater risk for adverse health outcomes. So the graphic on your screen really describes vulnerability pretty well. And this came from US Global Climate Change Research Program Health Assessment Report. So reviewing the screen, the first level shows exposure. And exposure is really the contact between a person and another stressor. So that could be biological, psychosocial, affected by a changing climate. Sensitivity, this is degree in which people or communities are affected. And that could go both ways, both adversely or beneficially. And then the ability to adapt. And this is how well communities, institutions, or people can adjust to potential hazards. So these 3 factors increase vulnerability, or what degree folks are likely to be affected. And that trickles down to poor health outcomes such as injury, acute and chronic illness, and that's health and stress-related illness, developmental issues, and even death. So some context and examples that we can think of are, we know that low-income populations, people in certain locations, and certain occupational groups, like first responders and construction workers, face more frequent exposure to climate threats. So extreme heat and disease-carrying insects and ticks particularly impact outdoor workers. We know that people with pre-existing medical conditions, such as pregnant folks and children, are more sensitive to adverse climate events. For example, people who have diabetes or who take medications that make it difficult to regulate body temperature are more sensitive to extreme heat. And older adults, people with disabilities, and Indigenous people may have limited abilities to adapt. For example, Indigenous folks who rely on subsistence food have limited options to adapt to climate threats to traditional food sources. For today's webinar, we'll be focusing on the impact of extreme heat on communities, which is a key stressor in Region 8. And we know that extreme heat is frequently based on how unusually hot and humid it is for an area. But with all that in mind, I think it's important for us to acknowledge that there are a lot of solutions and resources already available. As a national public health organization, NMPHI collaborates with a network of 50 public health institutes. The Environmental Health and Emergency Preparedness team convenes a work group of about a dozen members and developed this ArcGIS map showcasing some of their work. And you can access that right in the chat. So a couple examples, the Hawaii Public Health Institute has a focus on food security and nutrition. They convene a Transforming Food Systems Hawaii initiative. And that's a collaborative and multi-sectoral food system change initiative. And that leads into policy, education, and capacity building. The Public Health Institute for Western Massachusetts has a heat-related illness program. And they convene a coalition and work with Healthcare Without Harm and Pioneer Valley Planning Commission on a extreme heat tabletop. And that developed into a playbook called Partnering for Climate Resilience, a practical guide to community-based disaster planning. And of course, if you haven't checked out some of CHI's work in the mental health space, you're definitely missing out. The Colorado Health Access Survey, or CHAS, has asked Coloradans about mental health status and access to mental health care since 2013. In addition, CHI regularly evaluates a variety of statewide and county implementations of behavioral health programs. And these stem from small-scale behavioral health integration in clinics to larger-scale efforts like co-responder programs. And if you're interested in solutions, there's so much great work happening across the country and definitely in your backyard. But it's important to know what your community needs may be different to what another person on this call needs.
And with that in mind, we're going to head back to Menti. Yeah, so menti.com, enter that same code or use the same link that was in the chat, and I think it's being shared again. What types of climate-related events are of greatest concern for your communities? Extreme heat, flash floods, just about everything over there. Water quality, water scarcity, drought, wildfires. Yeah, seeing a lot of extreme heat and wildfires. Electricity issues, drought, tornadoes. Yeah, a lot of extreme heat issues. So you're definitely good to be in this space and hear about some of the solutions we'll chat about later. Thank you all for sharing about what's going on in your communities. And Josh, I'll pass it back to you for the slides.
Yeah, so back to the work that we did with the Colorado Department of Public Health and Environment. So through FIG, after learning that the connection between extreme heat and mental health was one of the primary concerns of the Public Health Department, Trailhead Institute conducted the literature scan to explore what the relationship between rising temperatures and mental health is. The inclusion for this scan included both international and national articles published since 2015, and it included concepts related to heat, mental health, and violence in the titles. More specifically, keywords for review included extreme heat, mental health, heat vulnerability, heat, extreme weather, heat stress, psychological distress, psychological health, heat waves, and heat extremes. This climate-inspired literature scan not only informs future public health programming, education, and advocacy, but it can also be used to apply international and national knowledge to address local challenges to really help mitigate the mental health effects of heat exposure in our communities. So a thematic analysis, which is just a research method to examine and uncover what themes and patterns exist in qualitative data, was conducted to explore the themes that describe the relationship between heat and mental health. So up next, our colleagues at CHI will further explain how these themes describe the relationship between extreme heat and mental health.
Great. So it was obviously a pretty extensive literature review, and there were 3 key findings from this literature scan. First is that heat erodes mental health. Heat and climate-related stressors have been associated with an increased risk of suicide, particularly during extreme heat anomalies. Research in the United States has found that rising minimum daily temperatures are correlated with increased suicide rates, especially among vulnerable populations lacking access to mental health care. Communities experience impacts differently. Vulnerable groups, such as older adults and economically disadvantaged populations, are disproportionately affected by extreme heat. One study in this literature review reported that worsened mental health outcomes during heat waves among individuals with lower education levels. But there are national, state, and local level solutions that exist to mitigate heat's impact on mental health. Interventions like green space and public health strategies show promise in mitigating heat's adverse effects on mental health. One study looking at urban heat waves proposed green space design to reduce urban heat and improve mental well-being. There are 4 themes that arose from this literature review that showcase the connection between heat and mental health. Rising heat was found to exacerbate violence. One study reported that there was a 1.4% increase in assault for each 1 degree Celsius rise in temperature. There were heightened effects among vulnerable populations such as teenagers. Heat stressors compound some challenges, such as economic and gender-based inequities. For example, one study reported worsened mental health outcomes during heat waves among those with lower education levels. Heat exposure influences mental health conditions. One study found a significant increase in hospital admissions for psychosis among adults with schizophrenia after 3 days of elevated temperatures. Again, on a positive note, a key theme that emerged is that heat-focused public health interventions can improve well-being and heat-related health outcomes. So what are some of these strategies and solutions for state and local public health? Several types of public health interventions exist. There is community-focused strategies that promote overall health. These are essential to address the inequities exacerbated by climate-related stressors. For example, interventions like green space have shown promise in reducing heat stress and its psychological effects like depression. Community-level mental health interventions. One study indicated that increased temperatures and exposure to flooding are linked to higher odds of anxiety, as well as co-occurring depression and anxiety. This really highlights the need for community-level interventions as well as further research on climate-related stressors. And studies have also found that heat and climate-related stressors have been associated with an increased risk of suicide, particularly during extreme heat anomalies, highlighting the urgent need for climate-adaptive mental health strategies, particularly for at-risk groups, to mitigate mental health impacts of climate change. There's also a need for tailored interventions, like population-specific risk management. Vulnerable groups, such as older adults and economically disadvantaged populations, can be more affected by extreme heat. For instance, one study reported worsened mental health outcomes during heat waves among individuals with lower education levels, while another emphasized that targeted heat risk management policies are crucial for low-income and elderly populations.
So as stated, heat-focused public health interventions can improve well-being and heat-related health outcomes in communities. And we discussed a little bit about how green spaces and parks are one way to address extreme heat, and they can also support our social, physical, mental, and emotional health. However, yes, we need green spaces and parks to support our mental health, but just because we have a park in our community doesn't necessarily mean that you can get there safely. So people need safe routes to conveniently access places for them to actually cool down, like parks and green spaces, to improve their health. Safe Routes to Parks is a public health intervention that increases biking, walking, and rolling with a focus on safe travel for children, youth, and families, and those experiencing health disparities. CDPHE, in partnership with the Colorado Department of Transportation, or CDOT, and the Colorado Parks and Wildlife, or CPW, created the first ever interagency Safe Routes to Parks action plan at the state level here in Colorado to increase access to parks and green spaces across our state. Supported by Safe Routes Partnership, which is a national organization, our state interagency partnership also worked with local communities in 2024 to develop the first ever local Safe Routes to Parks action plans. And half of the communities that we worked with are located in small and rural towns that have less resources. And the majority of those we worked with are also located in disproportionately impacted or DI communities, which is defined by state law here in Colorado and includes areas that may experience higher environmental and health burdens, such as low income communities, communities of color, housing cost burden communities, and linguistically isolated communities. The funding to support these efforts came from Safe Routes Partnership, as well as CDC's State Physical Activity and Nutrition Grant Program, or SPAN, CDC's Maternal and Child Health Program, or MCH, and then CDC FIG. Another public health intervention to address heat is inclusive playgrounds, which are play spaces that go above and beyond meeting Americans with Disabilities Act, or ADA standards, to ensure they're designed for all ages and abilities. Design features can include shade, trees, they can be smoke and vapor free to provide healthy air. They can provide seating areas and benches for folks to rest. They can provide accessible water fountains and bathrooms, adaptive swings and poured-in-place rubber, as well as splash pads, again, to help with cooling. CDPHE partnered with parents with children with special healthcare needs, ADA coordinators, park planners, park and recreational professionals generally, local public health agencies, landscape architects, and urban planners to identify inclusive playgrounds across our state, again, for the very first time. We developed a best practice resource guide for park staff and other built environment professionals. And we also co-created with the parents with children with special healthcare needs a playground checklist with inclusive amenities. And then we also were able to partner with the local community to create a case study example to share with other communities across our state. This work was also supported by funds from CDC's MCH, FIG, and SPAN programs. And it's also important to note our amazing state funders in Colorado that support these types of projects, including CDOT, CPW, Great Outdoors Colorado, or GOCO, and the Colorado Health Foundation. Additionally, CDPHE is supporting heat efforts in schools and childcare settings by working with school nurses to create heat action plans with students. We're also supporting local epidemiology staff with data needs, and we're partnering across different programs areas internally, including our wildfire smoke preparedness program. I know a lot of folks mentioned heat and wildfire smoke. We're working on that at CDPHE, and our wildfire preparedness program is funded by the Environmental Protection Agency, or EPA. Also partnering with our Office of Gun Violence, our Suicide Prevention Program, our Office of Emergency Preparedness and Response, our Office of Environmental Justice, and then our Healthy Communities Unit, which is where I work in, within our Prevention Services Division, and more. And we're really looking forward to identifying opportunities across our different program areas to apply the findings from this literature review to address negative mental health impacts as a result from heat. And one major next step CDPHE is already working on, in addition to some of the interventions that I just talked about, following this literature review, is partnering with the same DRPH student from the Colorado School of Public Health to create public informational messaging for the general public, as well as for public health professionals, and then parks and recreational professionals and city and town planners based on the evidence. So example messages include: addressing the mental health impacts of heat isn't just an individual responsibility, it's a community effort. Here are some ways we can all work together towards a healthier future. Green city planning. More trees and parks can cool cities and improve mental well-being. Cooling centers. Public spaces with air conditioning can save lives during extreme heat events. Mental health services. Expanding access to mental health care, especially for vulnerable populations, is critical. Climate adaptation policies. Governments should integrate mental health into their climate response plans. Another example is, remember, if you're feeling down, anxious, or unusually irritable during a heat wave, you're not alone. Take care of yourself, reach out for help, and stay cool. CDPHE will use these messages for implementation of our internal CDPHE Heat Action Plan and as a way to support local public health agencies and local governments in tailoring messaging to appropriate audiences during the heat season, which is happening right now in Colorado. Readily available and easy to use communications has been a consistent request from local public health agencies here in our state, and we're working on partnering with them to make sure that these can also be localized and very context specific.
There is a lot of great work happening at CDPHE around green space access and improving informational messaging about ways to mitigate the impact of extreme heat and mental health. And we also want to hear what's going on in your area to support high heat and mental health efforts. So again, we're going to use Menti. You can go to menti.com and use the code that's at the top of the screen, or there should still be the link in the chat. And again, what is happening locally to support high heat and mental health efforts? Cooling stations. That's great. I know CDPHE and the Denver Department of Public Health do a great job of highlighting what's going on across Colorado and across the Denver metro area. Cooltainers supplied by the county. Collaborative work across sectors to increase access to parks and green space. It's great to see more access to green space. Time breaks at construction sites to support rest and hydration. We're aware of some of that happening also through some of our Denver partners. A lot of education. That's great. That works great alongside some of the informational messaging that the support that CDPHE has gotten. Resilience hubs as cooling centers, great. Connecting with youth to address mental health impacts. That's excellent. There's a lot of really great work going on, and it's nice to see that it's not all just in one area. There's education happening, resilience hubs, connecting with youth and young adults, time breaks at construction sites. So working with outdoor workers is really key as well. And then we'd like to know, what do you need to know to further your work or start your work in mitigating health, heat, and mental health challenges in your community? So what would help you here? Data links. Since it's a not great toolkit available, I was curious if there's specific data links. We can add that to the Q&A, and we can just try to make sure we can include information and follow-up, access to messaging and educational materials as handouts, messaging and technical assistance support. Again, it really aligns with what CDPHE is doing. So it'll be great to see, that become more public, and seeing how it can be used across the country. That's great. I'll give it one more moment to see if there are anything else that we need to know. Great. Ways to measure impact of interventions. Are these strategies actually helping mental health communities in the communities I serve? Yeah. The evaluation of all this is really key. You might think that it's going to have a great impact, but we don't know for sure unless there's research happening afterward, or at least conversations with community members to check out the impact. That's great. Okay. Thank you all for putting this in here. It's good to see the messaging and the toolkits and data and the need for intervention. And then Josh, I'll pass it back to you for the slides, please. And again, I just want to elevate the key findings from this literature review supported by FIG's technical assistance. Heat erodes mental health. Heat and climate-related stressors are associated with increased suicide risk, especially around extreme temperature anomalies. communities experience the impacts of extreme heat differently. We heard a lot from Jaime around what's going on nationally and how maybe some tribal leaders will have a different farming needs than other areas of the country. So vulnerable groups are disproportionately impacted. But then there are national, state, and local level solutions, some of which we heard from Jaime and from Braden, to help mitigate heat's impact on mental health.
All right, well, the remaining 15-ish minutes, love to open it up for questions. So feel free to use the Q&A feature. Also feel free to raise your hand. We can ask folks to come off mute and ask questions to our panelists. But as folks, we've seen some nice feedback through the Menti tool. I'm not currently seeing questions in the feature, but feel free to start submitting those as they're coming up.
While we're waiting for some questions, I just want to highlight Gretchen's note in the chat that she likes the mental health messaging that you're not alone during extreme heat. So I think that was some of the informational messaging that you mentioned, Braden. So that's good to see. This is something that's impacting everybody.
I felt like a lot of folks in the Menti responses, they were talking about the connection between heat and wildfire smoke. And so something else I think is interesting, we're doing so much, I only shared like very few things we're doing. But one thing I also wanted to highlight is that for the very first time, we are working through the process of updating our state health improvement plan right now. Hopefully it'll be published soon, to be determined. Things have been pushed back a little bit, but for the very first time, we have climate change in there as a priority. And then within that, we are specifically focusing on heat and then wildfire smoke, which is super cool to do that collaboratively across our different program areas. And a lot of the wildfire smoke work too is really focused on syndromic surveillance systems. So increasing our data capacity and support for gathering that information. And then as part of this work too, like for example, we talked a little bit about how it's gonna be really hot here in Colorado in the coming days. And with that, we're working on preparing our Health Alert Network, or HAN, and really thinking about those connections again with how it's gonna be really hot, and then we're looking at data around wildfire smoke too, to see how that's gonna impact folks across our state. And then of course, we know that that relates to poor air quality as well. So just wanna share some of those other examples from the state level. And then I see, sorry, Carm, I'm taking
Yeah,
it
no, go
over
ahead.
from you.
Yeah, I saw Gretchen's
Also,
question.
hi Gretchen, good to see you. Are there CDPHE grants available for splash pads and shade interventions? Unfortunately, no. Yeah, I think just with everything going on right now, we are unsure what funding that may be available at this time for those sorts of interventions. In the past, we have used CDC's State Physical Activity and Nutrition Grant, or SPAN grant, to help fund some of the shade type projects in different ways. So no, we don't have grants at CDPHE, but there are grants, like I mentioned, through the Colorado Health Foundation that might be able to support that, Great Outdoors Colorado or GOCO. There is, oh gosh, I know that there's one other resource, and I can't think of it at the moment, that funds some shade canopy work. I'd have to look it up and get that back to you. I think we're sending some resources out after this, so I can make sure to include that there. I just can't remember off the top of my head. So yeah, and then yeah, Great Outdoors Colorado usually funds a lot of the playgrounds in Colorado for this work, which is funds through lottery tickets.
Right on. Yeah, and just as a reminder, we will be sending up a follow-up email, resources from today's conversation, and there's a wide variety of resources among all of our organizations. So If you do have additional questions or if things do come up as you're diving more, we had the first Mentimeter question, and it's kind of half of the people said that they were kind of just dipping their toes in or just getting started in extreme heat work, and others have been in it for a bit. But regardless of that, if there are resources that can be useful to you or questions you have, feel free to reach out to Team CHI, NMPHI, or CDPHE, and our information will be provided. So thank you, Mariah, for flagging that question from the Q&A. It is, what are some strategies to support mental health when dealing with wildfire smoke? And I open this up to any of the panelists. I will ask if the person who submitted that question feels feel free, like if you want to come off mute. I know it came in as an anonymous question, but love to hear a little bit more kind of behind that. Because we, like at CHI, and Maggie and I can riff a little bit about some of our wildfire work that we've done recently. I will say there are some counselors in Colorado specifically that do specialize in post-wildfire trauma. The impacts of wildfire smoke, of course, there's the physiological impacts, which then can have impacts on people's mental health. But I'll say this is a kind of a nascent growing area in the mental health sphere and the kind of counseling sphere of work for post-wildfire. There's multiple things, because we're talking about an exposure with wildfire smoke here, but there's also just the trauma of wildfires, and there are we know a couple folks that do that if you do want connections. And then we have another question coming in it says, do we have research or impact data on agrivoltaics, so solar panel use with gardens and livestock, on increasing shade, moisture, etc.? I would love to link current studies on benefits of agrivoltaics with human health benefits. So the use of solar panels and with gardens and livestock and agriculture, and the human health benefits. Anyone from our panelists want to take that? And it is a bit of a niche question, but we do. So what I'll say from CHI's perspective, we have connections to some folks at an organization called Agwell that do some work with farmers related to mental health, but also farmers related to like literally innovations that they're doing. And I'm happy to make the connection either to them, or there's some folks through CSU Extension Services here in Colorado that are doing more work in kind of that sphere of work. Happy to connect you with.
Yeah, I would also, similar, very niche topic outside of my area specifically, but in Colorado, yeah, we have the Colorado Solar for All program. They're partnering with Jack's Solar Garden. They're going to be doing like a workshop around this very topic and inviting state agency staff to attend and learn more about it, which I think is super exciting. So we can kind of integrate a lot of our different areas together and partner on this work, which I think is super cool. So timely, that's happening in July here. So we're excited about that. And then I wanted to mention with the question around wildfire smoke and mental health, a lot of it too, and this is with heat as well, but like this is social connection piece and how to provide opportunities for people to connect with their neighbors, understand what resources are available, have spaces that they can go to in times of need with wildfire smoke, which I know, we know can be difficult. So yeah, I think highlighting the social connection piece is really big for mental health too, and some strategies around that, whether it's programmatic, infrastructure based, connecting folks to resources and mental health services, etc.
Thanks, Braden. And thank you, Christy, for the question. All right. We got a couple minutes left before we wrap up. any other final questions that folks have before we close out here? And again, as a reminder, our next slide just has contact information from Colorado Health Institute. So if you do have questions, big or small, niche or broad, we're happy to either provide answers or information to those questions or connect you with the folks either from NNPHI, CDPHE, if appropriate, or folks that we may know that are doing anything from mental health and extreme heat work with cities to agrivoltaics with farmers. I think anything in between that. So if we can't answer it, we know the people that might be able to for you. Cool. Well, if you again, we want to thank you all for your participation in today's webinar. Again, a very timely topic, and we hope that this was beneficial to hear sort of a use case of how FIG has been beneficial here in Colorado in this sort of intersection of extreme heat and mental health and the resources that we have available in our state. I want to thank our panelists, our hosts today again, Diana and Jaime from NNPHI. I want to thank Maggie, Colorado Health Institute, and Braden from CDPHE. And I want to thank you all for being with us today, and hope you stay happy, healthy, and cool out there this summer. Thank you all.